Hello friends, today we will talk about the textbook which is published by Red Sol Institute of Cosmetology, and the name of the textbook goes like the Cosmetology Canvas. So this is coming in two volumes. So this is volume 1, this is volume 1, and this is volume 2. So there are 136 chapters, and the textbook is the entire volume 1 and volume 2 is 1084 pages, and the book is available on redsol.com and redsol.in, both the websites. Also you can WhatsApp on this number 977 if you want to get details of the chapters or have any doubts regarding the textbook. You can get it. The cost MRP of the textbook is 13,500 rupees, but for some time it will be available at a discounted rate of 7,500 rupees. So till the discounts are there, you can buy the textbook so that you get benefit of it. And the textbook covers all the current modalities of treatment of in the aesthetic medicine. So index, if you want to see, you can get it on WhatsApp. So do like and subscribe our channel so that you can get such updates. Okay, thank you. So now we will see the details of the book, the Cosmetology Canvas. It has two volumes, volume 1 and volume 2. It has 136 chapters and 1084 pages. So the book is divided into 6 modules. Volume 1 will contain module 1, 2, 3, and volume 2 will contain some part of module 3, then module 4 and module 5 and 6. So now what is there is in module 1, it is the foundation of cosmetology and the professional practice. So how to go about with the professional practice and the foundation of cosmetology, and it is there in this module 1. So it is introduction to cosmetology and the aesthetic industry, anatomy and physiology of skin, product knowledge, what are the chemicals that are used in the various products, maybe it sunscreen, moisturizers and peels, serums, what is the basic chemistry of these chemicals. Each and every chemical is discussed in detail, and the client consultation and the communication skills what you should have in the professional practice of aesthetic medicine or cosmetology. Now module 2 will focus on core skin aesthetics and facial treatments. So basics of the facial treatments what are done in this is there in the module 2. Then there is skin analysis and diagnosis. So how the various conditions of the skins are diagnosed, analyzed, that is there. So facial techniques, medicines in cosmetology, what are the allopathic medicines used in cosmetology, they are discussed in this. The medicines are for hair loss also and obesity along with the skin medicine. The basic techniques what are there in this module are electropathy in facials and non-surgical facelift, RF and MRF, high frequency galvanic brushing unit machines and radio cutting. So the basic tools or the basic treatments are there is in this module 2. In module 3 we will discuss advanced skin treatments and anti-aging. So and the chemical peeling. This is the major part of the book and this module also. So it will discuss the basics of chemical peeling, various chemical peeling agents, the application techniques, peels for specific uses like acne, scars, mature skin, sensitive skin, pigmented disorders. What are the peels that are used? And also it will cover the complications and ethical considerations of chemical peeling. And now the volume 2. So this was volume 1, now this is volume 2. Volume 2 will also, as I told you, it will be the module 3 is continued in this. Then after the chemical peeling that we saw in module 1, there will be other techniques like microneedling, dermabrasion, lasers and other machines. So whatever machines are used in the advanced skin treatments, it is discussed in module 3 of volume 2. Then it will, what is covered is IPL, hair removal, all the lasers, cosmetic lasers, then the diode laser, CO2 laser, Nd:YAG laser. Then also it will focus on photofacials, carbon facials, tattoo removal and HIFU. The other treatments that are there in this module 3 is whitening treatments, various whitening treatments that are incorporated, like the glutathione injections, and the acne treatments that will include blue light therapy and others. Also, this module will focus on mesotherapy, PRP, what are the techniques of extraction of PRP, how it is given, that is discussed. So also, the module 3 has LED therapy, hydrofacial, BB glow treatment, and some specific issue managements like anti-aging, melasma are discussed. Module 4 will discuss manicure and pedicure. And module 5, there will be advanced medical aesthetics like the fillers, botox, hydro boosters. We will discuss the procedure. So the theory part of these procedures and safety is discussed in this. Now module 6 is most important as per the business point of view. What are the different methods of clinic marketing? So if you have learned and everything in aesthetic medicine, now how to get benefit out of that. So clinic marketing, business planning of your clinics or the aesthetic centers, client retention, how do you retain your client, whatever the walk-ins are there, how you should be, how you can retain the client. The pricing, what should be the pricing of your treatments, the financial management of your clinic, so the aesthetic center, so how do you manage the finances, the digital marketing, and how to build a professional portfolio of yourself so that you can grow in this industry as far as the business is concerned. And for those who are doing the, learning aesthetic medicine for doing a job, we will teach you how to write a resume so that you can apply for jobs. So now these are the 6 modules covered in these 2 volumes of all the 136 chapters and 1084 pages. So now we'll see what are the individual chapters. So individual chapters are in section 1 of module 1. It discusses the introduction to the cosmetic industry, history, career opportunities in cosmetology, professional ethics, hygiene, and personal grooming. So from page number 1 to 32 is this much part. Then we will see the anatomy and physiology of aesthetics of the skin. So the anatomy and physiology, face, skeleton and muscle, circulatory system of the face, nervous supply, endocrines that are like we see in PCODs, you get melasma and acne and all. These are very so understanding of endocrines is very important with that. So from page number 89 to 94 we have discussed endocrines. Now we see the basic chemistry of the products. So whatever products you are buying, sunscreens, moisturizer, how to select that, what are the characteristics of the ingredients, what are the ingredients that should be incorporated, you should see in the products, that are discussed in this. So basic cosmetic ingredient, what is the pH balance, what should be the pH of the products, what is the pH of the skin, all these are discussed in this chapter from page number 105 to 1010. Now the retinoids in aesthetic, there are different retinoids. It's very complicated because there are many variants of retinoids, that like the retinol, tretinoin, isotretinoin, and what are the difference between them, that is discussed in this chapter. Then the botanicals, as it is trending, the herbal products, like they have botanical extracts. So these are discussed in the chapter number 14, botanicals, from page number 116 to 124. Then the vitamins that are used in the therapy or in the cosmetics, the skin lightening agents like glutathione, and the kojic acid, and different other resveratrol you have, that are discussed in this chapter number 16. And now the next chapter is 17, the hormone replacement therapy. So what are the different hormones, that causes issues, so that are discussed. Then the sunscreens, what are the sunscreen agents, what are mineral sunscreen, barrier sunscreen, different type of sunscreen. So what is the difference between each of them, that is discussed in this chapter number 18, sunscreen. Then we have the similar cleansers, toners, moisturizers, serums, masks. What are the different types of masks? What is a PAVA mask? What is clay mask? What is alginate mask? What is sheet mask? What are the difference between them? Where you should use which mask, that is discussed in this. And the most important, patch test. What is the patch test? How it should be done? How the result should be seen? This is very important. In every product, most of the product, you see, do patch test first. But how should it should be done? So that is discussed in this chapter number 24. And now we come to section 4, that is client consultation and communication skill. What are the communication skill? How should you should talk, and how records are kept, the clinical records. What are the consent forms for cosmetic procedure? What is this is very important, client expectations in aesthetic practice and managing. So this is very important thing in aesthetic practice, the expectations of the client and how you should address. So this was all about the module 1. Now from here we started the module 2. So analysis and diagnosis of the skin examination, skin types, what are the skin types, common skin condition, diagnostic tools, what is blue light, and various tools and various machines that are used for diagnosis of the of the different skins, that is. Then how you should make a treatment plan. So you have understood what is the issue, what is the skin. Now you have to analyze and plan them, that is discussed in the chapter number 33, page number 280 to 285. Now the basic facial techniques, like professional cleansing, how cleansing is done, how exfoliation done, how steaming is done. Then comedone extraction, how do you do all the theoretical part of all these basic procedures is discussed. What is the facial massage, what are the masks, how do you do apply mask, that is discussed here. And various very important post treatment care. So what are the post treatment cares in various different treatments? If you're done, then what should be the care that is taken after the treatment, and how you should explain it. Now this was section 2. Now the section 3 is medicine and cosmetology. So what are the different allopathic medicines that are used in cosmetology? That is discussed in this chapter, page number 339 to 351. And then there are separate chapters for hair loss. What are the different medications for, like finasteride and then minoxidil? What are the medications? What precautions should be taken? What are the dosage? Everything is given in this chapter. And then the medicines for obesity. So the different medicines now are available in the market. All these are discussed in chapter number 43, page number 360 to 366. Now section 4, basic electro therapy in facial. So non-surgical facelift, RF, MRF, and galvanic brushing units that are used in aesthetic medicine and radiocoding. These are the basic electrotherapy in facials. Now the module 3. The module 3 starts over here, chemical peeling. So these are all the chapters. What are the application of peel? What are the different chemical agents? Peels for the specific issue. Then TCA, retinol, or the yellow peel. What are the peels that are that can be used in body? Then periocular peel, the under eye peels. For mature skin, what chemical peels you use? For sensitive skin, what chemical peel you use? Then chemical peeling in males, pigmented disorder, that is whitening. What are the sequential peels? Sequential peels means you apply more than one peel, that is called as sequential. Then there is spot peeling. What is spot peeling, or also known as cross treatment? They are discussed in this chapter. Now we get many a times what all can be done with the chemical peels. So people are not happy only doing the chemical peels, they want to combine other technologies. So what are the technologies that you should combine and what you should not combine? So that is discussed in this chapter number 69, page number 570 to 572. Then marketing, business and ethical condition in chemical peeling. Then complications of chemical peeling. What are the different complications of chemical peeling? How do you handle those complications? That is discussed in this chapter number 70. Then we have a separate chapter for products of Rexall chemical peel. So all the chemical peels that is provided by Rexall are discussed in this chapter number 72. Now we start with the volume 2. It has the module 3 continues over here. Now these chapters in section 2 is microneedling, dermabrasion. Dermabrasion, what are the different positions of dermabrasion, derma roller? How to ideally use the derma roller? Where should you use? Where you should not use the derma rollers? Now the section 3 is lasers and other machines. So what lasers are discussed over here are cosmetic lasers. What is the principle in this? What are the basics of lasers? What are lasers? So it is discussed in this detail. There are 20 pages over this for the basics of laser. Then specific lasers is continued further. The lasers for hair removal. What is IPL? Entire thing of the IPL, like what are the machines, how this work, and where you should use it, what are the complications, everything is discussed in this IPL chapter number 77. Then diode laser, CO2 laser, everything details like the IPL, everything is discussed over here. Nd:YAG laser, Ebrium laser. So these all lasers are here from up to chapter number 81. Then we come to photofacial, carbon facial. What is carbon facial? Now this is tattoo removal. So laser tattoo removal. This is basically chapter on laser tattoo removal. How it is done, what are the machines used in the laser tattoo removal. Then there are, since this is not a laser chapter, but since the tattoo removal has come here, we have added this chapter. This is non-laser techniques for tattoo removal. So tattoo removal can also be done without a laser. So what are the techniques that is given in the chapter number 85. Then chapter number 86 is HIFU. Now we come to section number 4 in module 3, that is whitening treatments. So what are the different whitening treatments? So the first chapter is glutathione injection. Entire chapter is there for glutathione injection, 4 pages. And skin whitening treatment. So what are the different skin whitening treatments that can be incorporated? Then the section 5 is acne treatments. So acne treatment, what are acne is, what are the different modalities that is here in page number 758 to 764. Then what is blue light therapy for acne? It is a very popular therapy for acne. Now section 6 is mesotherapy. What are the different modalities of meso? What is ultrasound meso? What is meso with dermal rollers or injections? Everything is given in here. And the next chapter is mesotherapy by injection. So how do you do mesotherapy by injections? Is there in chapter number 92. Then section 7 is PRP, that is platelet rich plasma. So in this we discuss what the principle of PRP. Then the next chapter is PRP harvesting, and then what is PRP administration, how PRP is given, and also a very important chapter, what is vampire facial. So vampire facial, as you know, or you will learn here is how vampire facial is done, what is it, what are the principles, how to do, then what are the recent advances in PRP. So this is chapter number 96, advances in PRP. Then section 8 is LED therapy, the LED principle. What is LED principle? How the LED procedure is done. What are the complications? How you should do the procedure. Everything is discussed in details in these 7 pages of LED therapy procedure. Now the next section is hydrofacial, very popular treatment. What are the principles of hydrofacial? Hydrofacial machine, is the idea of hydrofacial ideal machine you should buy, and the hydrofacial procedures. So how hydrofacial is done, what you can incorporate with the hydrofacial, what you cannot, that all everything is discussed here. And the next section is baby glow treatment. Baby glow treatment. Then the section 11 is advanced facial. These are facials which are advanced. This is oxygenofacial and cryofacial. Some people may not be aware of this. These are advanced facials. Special machines are incorporated in this, that is discussed in this. Then what is there is specific issues. We are discussed from in section 12 specific issues and how to manage them. So a holistic approach involving various modalities are discussed. So for anti-aging process, what do you do? Anti-aging treatment, what is there? And then now this is very important, sensitive skin. So if there is a sensitive and compromised skin, what are the treatments you can do, what the care you should do. So everything is discussed in this chapter number 107. Now the another is melasma. So in this also various modalities of treatment for melasma are incorporated. What are the different treatments that you do for under eyes? Then for warts and moles, what are the different treatments? And also now the another is non-laser hair removal is discussed over here. So without using lasers, laser hair removal is there along with the other lasers, but there are some techniques for non-laser hair removal that are discussed in the 6 pages of from 906 to 912. Then this is section 13 is micropigmentation, microblading and micropigmentation. This is a new modality now, very popular. Here ends the module 3. Now so you have seen, we have discussed all the major treatments that are available in the current market, what are done in today's world, that are discussed till now. Now this is a special section for manicure and pedicure. So nail anatomy, physiology, what are the name, common nail issues, how do you diagnose them. Then the spa, manicure and pedicure, what is them. Then basic gel polish in manicure and pedicure, hand and foot massage. So this is all about, these 5 chapters all about the manicure and pedicure. basically the nails of hands and feet. And now the module 5. Module 5 has recent advances in aesthetic medicine. So what are the advanced procedures? So even if you are not doing this procedure, you should understand the theory of it, so that if you are discussing this with any client, you should be aware of this. Introduction to advanced medical aesthetics. So this is the chapter 118, patient safety and sterile techniques. So this is section 1, advanced medical aesthetics. Then section 2 is fillers. Everything about the fillers is discussed in this section. Dermal fillers applications, indications of dermal filler, injection techniques, so how the injections are given, side effects, contraindications of dermal fillers. If you are qualified enough, you can do it, but if you are not doing the procedure, still you should know what are fillers, so that you can discuss your clients, refer patients for fillers to some big dermatologist or the professional who has the skills and is qualified to do that. Then similarly, these advanced Botox now we see in the chapter number 125 from the section 3 from here. Botox mechanism of action, how Botox works, indications of Botox, Botox injection techniques, side effects and complications of Botox. So you can understand the theories. Now the another advanced techniques, that is hydro boosters, and there are two things involved in this is Profilo and Voliti. So this is in section 4. Now we come to module 6. From here we come to the last module of this book, that is we understand the clinic setup and business in aesthetics. So how you set up the clinic, and how you can do a good business in aesthetic industry. So clinic marketing and management, basics or planning of an aesthetic clinic, how your clinic should be according to your budgets and all everything, or the area where you are practicing. How do you retain the client, the walk-ins that are there in your clinic, how do you retain the different strategies are discussed in this. Customer service excellence in aesthetic medicine. So what best you can do for the to achieve customer service excellence. What are this is very important, pricings of your services, how you should price the services, the financial management basics in aesthetic medicine. So how do you plan the finances in the aesthetic medicine? So if you, what is your budget, how you should plan, how much you should keep for your day-to-day expenses. So this is what is discussing this thing. Now, and the very important thing in today's world is digital marketing of beauty professionals, social media, online presence, how you should do that. So that is discussed in this chapter number 134 of this book, page number 1069 to 1074. And now building a professional portfolio. So this is like a brand building. So you as a doctor should become famous, so that wherever you start working, if you are going to new place also, if you have a good profile of yours, then this can be achieved. Then if you are not having your own clinic, but you are want to do a job, then what is how the resume you have to write, resume building, interview skills for a job. So if you are going for an interview in an aesthetic clinic, what care you should take, that is discussed in this last chapter, chapter number 136 of volume 2. So these are the two books. Now the price of the book is 13,500 rupees, but now it is available at a discounted price of 7,500 rupees. You can order from this number. If you have any queries, you can WhatsApp on this number. Now we'll discuss one of the chapters so that you can have how the book chapters look like. So we'll discuss one chapter, and the chapter is chapter number 56, TCA. I have randomly chosen one chapter. So this is chapter on TCA. So this is what is the first page will look like. It will give you a brief discussion. It will give you briefly what are we discussing in this chapter. So that will be on the first page. Then how TCA works, what is frosting, keratocoagulation, what is how this is the principle of it. So how TCA works, it discussed. So frosting, what are the photos of frosting is given. Then so we come to then it is discussed what is superficial. If you want to do superficial peel with TCA, then what strength you should use, how then what is the treatment frequency, the results, how they come, depth and penetration of the TCA, though this, and then the medium strength, medium to deep peel. If you want to do, what is the strength you should use, where it is used, where it is done, what is the depth of penetration, the expected result, the recovery process, the treatment frequency. So everything, how the product look like. So everything is discussed in detail. Now if you want to do a deep TCA peel, so what strength you should use, where it is used, what are the important salient points you have to take into consideration, how deep these peels go of this strength, what is the recovery process, the treatment frequency, how should be done. Now then general consideration of TCA peeling, what is professional application, pre-peel preparation, how it is done, then the post care, the side effects of TCA. So everything is discussed in detail of this everything. I'm just showing you one chapter, but in similar way everything is discussed. So now what is the TCA cross procedure, introduction of cross, what is the difference between a peel and a cross, how cross works, what are the strengths used in for TCA cross, then the indications of TCA cross, what is how do you assess the patient before doing the TCA cross, what are in the indication, who are the ideal patients, then the skin preparation, how you should prepare the skin, is there any anesthesia involved or not involved, how should be done or not, the application preparation, how should be applied, the frosting observation, how you should see for the frosting, then the complete treatment, where when you will find complete treatment, how what will be the outcome, then the procedure, care and the recovery. So what will happen in immediate, what would be you have to do in first 24 hours, 2 to 3 days, 3 to 7 days, and after healing. So what care is required in TCA, special instructions, how sunscreen, moisturizing, makeup, irritants. So everything is discussed in details of all the procedure. I am just showing you one procedure, one chapter, but in the similar manner the entire textbook goes. What are the number of sessions, results and side effects of TCA cross, treatments, sessions, what are the post-transition side effects and complications. So everything this is discussed. Now there are confusion about what is cross and what is TCA peel, TCA cross and TCA peel. So what is, so the difference between them is discussed, so you understand what you are doing, why, what you should do. So this is the concentration, what is used, application area, primary goal, mechanism of action, downtime, risk of pH, complications that can come, everything is discussed. And then the conclusion. So this, you see, this how the entire textbook goes. So these are 2 volumes. So if you want to buy, you can contact us. So this was all about the index of the book Cosmetology Canvas Volume 1 and 2 of the book published by Red Soul Institute of Cosmetology. If you have any further queries, you can WhatsApp us on the number 977-3494-509. And if you want to purchase, you can WhatsApp also, or you can go to the website as set up before. Thank you.